We are live this afternoon at Carilion Clinic's Patient Transport Headquarters to talk a little bit about our new pediatric ambulance that we have and all of the features that come with it. We have Jesse here, who, Jesse, tell everyone a little bit about what you do with us.
I'm the EMT for the Neo-Peds transport team. I take care of all the EMTs, maintain the trucks, and help our nurses and therapists any way we can throughout transport.
And so we have this new vehicle now with all of the most advanced technology for taking care of our neonatal patients, our pediatric patients. So you're going to be part of giving us the tour today. So we have the first 360 degree that you want to show us. So if you get in on the driver's side, we'll climb up here and you can give us an example of how it works. So tell us what we're looking at, Jesse.
Okay, on this screen that we've got here, I've got a view that gives me 360 degrees view of all around the truck. So if we go into a tight hospital, if we go into any tight places we can see around the truck, also look for any kind of pedestrians.
Perfect. And so then we have some other safety features with this ambulance, and I'm going to let you sort of demonstrate. I'll go ahead and get started and sort of help. Tell me a little bit about this feature.
We're set up so we can take care of either pediatric or neonatal patients. So we carry both kinds of stretchers. This stretcher is actually a self-loading and unloading stretcher, and I'll demonstrate that for you.
So this is not only better for our patients, but also for our folks taking care of our patients.
Yes, it is. And as you can tell, we stay level throughout the motion of the stretcher to keep your patient level at all times.
Which is very important. So now tell me about this generator that we have in case if the truck broke down or something happened.
Any kind of event that we occurred that we wouldn't have power for our main truck, we have additional power for a generator, also AC heat system. So we have electronics to run everything that we have inside the truck.
And we're going to talk a little bit about why that temperature is so important here in just a little bit. But this truck also has, this ambulance also has some other features, whereas you were telling me earlier, Jesse, that typically an ambulance might only have oxygen, but we have more than that now.
Yes, we do. We have medical air, heliox, that are main onboard tanks, so we can take care of any kind of patients that we have and blend to whatever their patient needs is.
And then let's give another demonstration about our stretcher technology. And I want to point out, so those of you watching and joining us might think that our pediatric patients don't weigh that much. Well, Jesse and the team were explaining to me that we may have a very teeny baby on board, but their isolette at their end weighs 300 pounds. The stretcher itself weighs 200 pounds. So you're looking at 500 pounds for getting the patient stable and into the truck the way they need to be. And so this makes their job so much easier. Also, as Jesse was mentioning, allows the patient to stay completely level, which is particularly important with our neonatal patients. And Jesse, we thank you for your time, because now we're going to go inside and we're going to talk a little bit with Leanne about some of the features that we have inside this vehicle. Hi, Leanne.
Hi.
Thanks for joining us today for our Facebook Live. So we were just talking to Jesse about a lot of the stuff that we have outside, a lot of the mechanical things this vehicle offers. But tell me a little bit about, one, why it's so important for our NICU babies to have so many things temperature regulated and what we have for this.
Sure. It's very important for babies' temperatures to be stabilized and normal when they're premature and infants. If you don't normalize their temperature, that impacts every system within their body. Their heart rate drops, and that leads to other issues.
And so we have our blanket warmer.
So back here is a blanket warmer. No other ambulance has a blanket warmer, and it's just to help with that temperature control. We also have a refrigerator, and this keeps the medications that we have to use for especially the premature babies, but also some of our pediatric patients within a normal temperature range that's required.
Now tell me, so we were looking at the tanks that we have on
Sure.
board. Tell me a little bit about what those tanks are.
Okay, sure. So here, this is the Heliox, and what Heliox is used for is our asthmatic patients. It is a smaller molecule and makes it easier for the oxygen to get down into the lungs. This is our medical air and our oxygen. It's very important for premature babies not to put them on 100% oxygen because it damages their eyes.
And then tell me, when I introduced you as Leanne, but you tell us a little bit about your specialty with Carilion.
Okay, sure. I am the unit director for the neonatal pediatric transport team as well as the pediatric ICU, and was a member of the neonatal pediatric team for 6 years earlier.
And so you know exactly how this equipment works, how it improves our patient experience. Tell me about this little computer screen here and what that does for us.
Okay, sure. So here on the computer screen you can see O2, air, and Heliox. That allows us to monitor the level of the tanks that Jesse showed you on the outside of the ambulance. Another feature is that if we have a change in our patient condition and we're in the back, we can go to this screen and push this button. That will alarm up front, letting Jesse know that we've had a change in the patient condition. And it's really important to do that without yelling up to him because we may have a parent riding with us and we don't want to upset the parent.
Exactly, but you want to get that message
Get the
across
message to Jesse.
as efficiently as possible.
Yes.
So we were talking about temperature being important, and we have the blanket warmer, but we also have an IV warmer.
Sure, that's to maintain the temperature of the IV fluids because you don't want to administer really cold IV fluids, especially to our neonates.
And so one thing we talked about is not only is this great for our patients, but also for our providers, our first responders, our EMTs. So let me have you give us a little demonstration about how these new safety belt features work.
So all you do is you're going to rock in. It's nice. What we can do is we can actually stand up, lean over, and take care of our patients. And if we need to sit back down, or if we come to a sudden stop, it will pull us back down so that we're sitting down safe and not moving about.
That's fantastic. And then tell me, Leanne, about the other feature that we have. We keep talking about how temperature is so important for these patients. Tell me about what this does.
Sure. So in this cabinet over here, we have, it's a temperature controlled cabinet. It's not going to get as cold as the refrigerator, but it's going to maintain our drugs that do not, or medications that do not need to be refrigerated at the appropriate temperature, as well as a few other things that we use to take care of the patients.
Thank you so much, Leanne. I appreciate the time that everyone has given to give us a little tour of our new vehicle. I should make sure that I point out that this is a partnership between Children's Miracle Network and Carilion Clinic. And so this is something that we are so excited to be able to offer our patients as the region's only neonatal intensive care unit. And to tell you a little bit more about this vehicle, we refer to it as a neonatal pediatric mobile intensive care unit. So that's the best way to describe this vehicle and all that it has to offer our patients and their families. And we just thank you for taking a tour with us, and just hope you have a great rest of your day.